Thank you, Hyen, for that amazing conversation with you. And it's so good to get to know you. Thank you so much for that gracious introduction and for having me here this evening to talk about a very, very complex topic. I'm not sure whether, I will do it justice, but, we'll try and cover some things this evening. Okay, so thank you so much for those of you who Hyen has mentioned just now, who have responded to the Mentimeter survey. We really, really appreciate that. And, we'll go through that in a couple of minutes time so that what what are the responses from this community. Okay, so I thought I'll just share screen. So do let us know if you find that, you can't see some of these things, okay? Right. Okay. Tonight, I thought that, I will start with just managing our expectation for this evening. Yeah. As I said, I think that the field of addiction is huge. And so, we have very limited time to talk about it. But I thought that I will just let you know what this session is not about. Okay, so this session, I'm not going to talk about how, one can tell if someone is having an addiction disorder or, any form of addiction related substance abuse disorder. So it's not about diagnosis. I'm also not going to talk about treatment, right? What are some of the treatments for addiction, for example? I'm not even going to talk about how do we counsel someone who's struggling with addiction, because I think that, these are things that can be left for the group of people who has that as a role. The professionals, the medical professionals, the psychologists, the counselors. But what we really need to do as a church is to provide soul care. And in providing soul care, looking after, being a community to individuals who struggle with addiction and also their family members is part and parcel of our role as a church. So I thought that tonight we will focus on 3 things that will help us increase our empathy as a community, because this is something that is sorely needed if we want to walk alongside someone for the long haul in managing addiction. So I'm going to do 3 segments, and we'll start with a perspective on addiction, because it's really, really important to understand where we come from and how do we actually look at the whole issue of addiction, and also, how do we normally react to individual with addiction. And secondly, I think it is also very important for us to have a better idea of why addiction is so hard to break. We often ask a lot of questions on, why is this person always, failing again, right? We use words such as this, not because we don't love the person, but because we're so frustrated at that repeated attempt to break addiction. And then the third segment, I'd like to sort of share with you, some of the things that I observe as lacking in the care of those with addiction. So that's what tonight will look like. And the whole aim of tonight's session is to increase our empathy. I think it's great. I think the fact that all of you are here this evening is because you empathize. It's because, you do care and love people. But empathy is something that we need to develop and constantly develop. And so therefore, we're all here, including myself, to increase empathy with regards to the field, okay, the whole topic, the whole aspect of addiction. So that's what we're going to do tonight. So I thought that, we'll start with the perspective on addiction, and we will start straight away looking at the survey that, you kindly responded to. So I'm going to share the survey response, just to give you an idea, what we're looking at. Can you see this? Hyen, is it okay on your side? Can you see the survey?
Yes, I can see it.
Great, excellent. Okay, so when you look at this is the response to the first item. The first item asks, what is one word? Okay, so if you come across addiction. What is that one word that come to mind? It's like a knee-jerk, you know? So what is that one word? Now, in this response, you can look at the words. The bigger the word is, the more people who responded with that word. So if you look at it in, very quickly, words such as drugs, okay? So drugs is actually the top one word that came to mind to most of these individuals who responded to the survey. And then next come, pornography, drug, bondage, habit, and then, all the other things, that people sort of offered. But 4 words stands out. Drugs, and there's another one without an S, drug. So actually drugs is the top. And then we have pornography, and then we have bondage. Okay, so that's the first item. Now, the second item, okay, this is where I need to ask you a question, because this is deliberately asked this way. So I ask you to sort of fill up this sentence. Addiction is a choice, and then not at all or in every way. Addiction is compulsion, not at all and in every way. I don't know how many of you have have taken a pause and thought about it and felt that it's not so easy to answer this question, or that, it's not like a knee-jerk, like how you could actually put the word drug immediately as a response to the first item. Now, it is not easy answering this question because it depends. It depends on, the context. Addiction is a choice in certain contexts. Addiction is a compulsion in a certain context. The picture is not so clear-cut. So if you have some difficulty in just giving the response and you're not so sure, right? You're not alone in this. And so this is your response for tonight for the survey. And I'd just like to move back to the PowerPoint right now and to go back to the presentation. Okay, so we've got a glimpse of your perspective about addiction. But let me share with you that whenever addiction is being talked about, when people are asked about addiction, generally there are 2 schools of thought, generally, okay, broadly speaking. The first school of thought is, it comes around 1837 during the Victorian era, where people think that, addiction is a matter of choice, that addiction is something that people deliberately decided to engage in. And as a result, the person who is addicted to either a substance or an activity is associated with some negative character, right? They are seen as, for example, not very moral, because, they should know that addiction is not good for them and that addiction causes a lot of problem. And yet they still decide to choose to be involved or to engage in addictive behavior. So there must be some people who are rather selfish. They don't think about other people. They just think about their own welfare, their own pleasure, and what they want to do. So with this school of thought, there is a huge degree of stigma associated with individuals who are addicted to a certain substance or activity, and that there is a lot of blame placed on the individual with addiction. There is another school of thought that comes, sometime later than the school of thought that, addiction is a choice. People start to think in 1930s onwards that, that addiction is a form of compulsion, that people can't really help themselves. It is not a matter of will. It's not a matter of deliberate choice, specifically, but that it is something like a chronic brain disease. It's like a disease that a person has. And, when you have a disease, you can't really help having those symptoms. And so that, this form of thought and perspective is made more popular in the 1980s and 1990s when we start to understand a bit better the function of the brain and the brain involvement with addiction. Now, this perspective tends to be perceived as more compassionate because, they help us understand a little bit more about the process of addiction. And, so it's not as stigmatizing as the other perspective that look at addiction as a choice. However, some perceive it as, well, then you reduce personal responsibility for engaging in addiction, which is a choice. People choose to engage, at least to start using a certain object of addiction and engaging a certain activity of addiction, right? So there is this thing, and we're starting to see, isn't it, as we look at the perspectives of addiction, we start to realize that the picture is not so straightforward when you look at choice and compulsion being involved in addiction. The picture is not so straightforward. So we don't have a very clear-cut, neat picture as to how much of addiction is due to choice and how much of it is due to compulsion. Nowadays, when you actually look at the data on what contributes to addiction, there are many, many factors. In fact, what make up, right, or how someone develop addiction is due to multiple factors. Now, in front of you, I've actually put a few factors that has been shown to contribute to addiction. Now, on the left panel, on your left, as you look at it, now these factors are more subjected to choice, whereby the ones on the right panel is less subjected to choice. So for example, of course, the decision for someone to start using a substance, the decision to continue using the substance, even though substance may be harmful or may not be as, efficient or, contributing to the welfare of the person, they can decide to continue using it. And decision to reduce, for example, is also a choice. And decision to avoid, relapse, trying to put in a lot of effort so that, you do not use again, is also a choice. Now, these things are more to do with choice, right? We can choose. However, the ones on the right panel, for example, are biological makeup, our genetic predisposition. Yeah, whether we are more genetically predisposed to be more impulsive in terms of personality, whether we are more susceptible to developing alcoholism, or the way that our stress management system is made up, our makeup, the kind of socioeconomic status that we are born into, the kind of environment that we live in, whether the environment is inundated with trauma, with difficulties, and whether or not we have a mental illness. These are all things that we cannot easily control, and a lot of it is outside our control. So we can say that all these factors contribute to the development of addiction. And if you look at two individuals with addiction, what contribute to their addiction will be different, a different combination of factors. So the picture is not as straightforward, although we understand that there is an interaction between choice and compulsion. Both are involved, but the picture for each individual, how their development of their addiction is very, very different. So I thought that we should know that, to have just that nuanced understanding of what contributes to addiction. The picture, again, is different for different individuals. But what is clear to us, okay? What is clear is that at the center of addiction, there is this deep-seated pain. So the object of addiction is used as a coping to help, with certain issues in life. Okay, whether or not there is a deep pain, well, many people have that. And so addiction, at the heart of addiction, there is this deep pain. Now that is quite clear. So even if people choose to use a substance or to engage in an activity that reduces this pain, even if they choose that, we mustn't place too much emphasis on the choice that they have made and neglect or discount the pain that forces them to make a certain choice. After all, I think that the person is more important than the choice he or she makes. I think it's always the case that the person is more important than the choices he or she makes. So if we as a church wants to provide soul care, we must go beyond moralizing. What do I mean by that? In a conversation or in an understanding of addiction, we must go beyond evaluating whether or not someone's choice is right or wrong. And we put a lot of our energy deciding, whether one should make such a choice. Because moralizing addiction does not help the individual struggling with addiction, nor the society at large in managing addiction. We must go beyond moralizing if we want to provide soul care. Hence, it is very important for all of us to not miss the point. Okay? Let us not miss the whole point about addiction. Addiction is coping with pain rather than seeking pleasure. Addiction is more about want and less about liking. For example, we don't necessarily like the things we want. For example, when I have a headache, I want to take Panadol, not because I like the taste of Panadol, but I want what the Panadol can do for my blinding headache. So now we know that with current data, addiction is more about wanting rather than liking. So it is really, really important for us as a church to have a much greater and nuanced understanding of addiction if we are to be effective supporter in providing soul care to those who needs it. Individuals with addiction and who struggles with addiction are almost always struggling with shame. As I mentioned before, right, those who are wrestling with addiction, sometimes, or in fact, a lot of the time, they are associated with negative character. And they are stigmatized as well in terms of character, that they are, they are people who are weak perhaps, and that they are people, who make poor decisions, and they are always falling into temptations, they are sinners, and so on and so forth. And it's no wonder that individuals who are struggling with addiction tend to hide away into isolation because of this deep shame that is associated with the experience of addiction. And we must be very, very careful that we do not, shun people into isolation. So let me repeat, what I mean by shame. I think in my last session with STM, we did go through what shame is. Shame is a very, very painful emotion that arise from a sense of self-condemnation because they think that something is not quite right with them, something that as part of them is flawed. And so therefore they experience this, self-condemnation. And if they do self-condemn, they also think that others should not accept them and that others should also reject them. And so this emotion of shame is a very, very painful one that places an individual who experience shame into this cycle of shame. So when one feels shame, they are more likely to think that they are flawed and that because they are flawed, people are not going to accept them. And when this self-stigmatization continues, there will be there will have to be some ways that they cope with this pain. So they may cope with behaviors that are maladaptive, things that are not helpful at all. For example, avoiding, withdrawing from people, getting angry with people, blaming themselves or other people, and yes, engaging in addictive behaviors. So if you look at this cycle of shame can be perpetuated by certain coping mechanism, but not only that individuals with addiction not only experience a cycle of shame, they would also be embedded in this addictive cycle that we will also be talking about in a few minutes. So looking at that, we need to understand that reducing shame is a concerted effort that we have to do together. Reducing shame is part of managing addiction, and we need to do this together. I hope that in the future, when this question comes again, that what comes to our mind will be words such as pain, words such as shame, words such as compassion, words such as help, rather than drugs, pornography, bondage, although those are all true too. So I think that tonight, let us just examine our own perspective of addiction. How do we look at addiction, and how do we respond to individuals who are struggling with addiction? This is an important posture for all of us who are committed to provide soul care, because when we provide soul care, it involves providing care for those who struggle with addiction. Now let's look at very quickly the definition of addiction here. And this is the definition by Nick Heather, which is, commonly accepted. So a person is addicted to a specific behavior if they have demonstrated repeated and continuing failures to refrain from or radically reduce the behavior despite prior resolutions to do so. Now, if you look at this definition, the first thing that comes to mind is that individuals with addiction are trying very hard to come out of addiction. But their attempt, they need more than one attempt. It's as if that, they have to repeatedly do this. So it's not an easy behavior to come out of. Okay, and so this definition allows us to see a picture of what addiction actually involves. It's very different from just being a habit, right? But this addiction is like, the repeated and continuing failure to refrain from, right? They really intentionally want to avoid addiction, object of addiction or activity of addiction, but they find it a challenge. What is the difference between individuals who are addicted to a substance or activity and a person who is a casual user? The difference is problematic engagement. Now, this reminds me of a few passages in the Bible. So let me just digress a little bit to look into these passages. In 1 Corinthians 6:12 and 1 Corinthians, a few chapters later, chapter 10, verse 23, it talks about our Christian liberty, but with limitations. It says, I have the right to do anything, you say, but not everything is beneficial. I have the right to do anything, but I will not be mastered by anything. And again, I have the right to do anything, you say, but not everything is beneficial. I have the right to do anything, but not everything is constructive. We have a liberty to do many things, but what we do and how we do it has a consequence to us as an individual, the temple of the Holy Spirit as an individual, and it has consequences on the temple of the Holy Spirit as a community. And what I wanted to say here is that, for example, mahjong. Mahjong is a great game. I think it's okay to have a game of mahjong, to learn how to play. It's a very, very good exercise of your cognitive ability. That is very, very good game, strategizing game. But it is something else when playing mahjong becomes an addiction. I think it's okay to enjoy and study the great length of material information about wine. Wine is so sophisticated, and there's just so many things that you can enjoy about wine, not just drinking it. We can also enjoy with friends, as fellowship, and really, really enjoy the whole process and experience of drinking wine together. However, when drinking wine becomes an addiction, that is something else as well. So I think today when we look at addiction, there's generally two ways that we can classify addiction. One is we can classify under substance addiction, things that we consume. So if you look at the list in front of you, I think that many of you are quite familiar with at least a few of the items in front of you. Now, these are all drugs, by the way. And yes, caffeine is a drug. The definition of a drug is anything that you are introducing into your body that changes the physiology, okay, that creates certain changes in physiology. That's the general definition of drugs. And caffeine is in the same category as cocaine and nicotine as stimulants. They are stimulants. And if you want to learn more about all these substances, you can go to this website that I have given you here, all right? And you can learn from clicking any of these words, and they'll tell you more about each of these category of drugs, or that particular drug that you're looking for. Let's say caffeine. Okay, you can click on the caffeine word here. Okay, not cocaine, but caffeine, and then you could sort of learn more about what caffeine does to our body, and any other things that you want to know. So it's a very, very useful material to engage in. Now, addiction can also be classified under behavioral addiction, things that we do. Okay, gambling, sex, gaming, internet, pornography, TV, and the rest of these activities, right? So either it is something that we consume or it is something that we do. The commonalities between these two categories are the three things I would like to go through this evening, or mention as we go along, right? The two categories of addiction, substance addiction as well as behavioral addiction, they produce pleasure. They provide pleasure, produce this high. Both of the categories do so. Second thing is that they produce cravings. They activate our brain reward system. And so, create this desire to have more frequently, more in terms of amount. Okay, this craving. So we are not having it, we'll be thinking about that. And lastly, the third thing that they have in common is that both substance addiction and also behavioral addiction, they tend to create this tunneling of vision. Okay, they tend to sort of make us neglect normal or important activities. So these are the commonalities of the two categories of addiction. Now, being addicted doesn't mean, strictly speaking, that someone has a substance use disorder, right? And officially, someone has a substance use disorder if they have severe functionality problems. What I mean by that is that, they start having this, severe difficulty in controlling the use of the substance, okay? And they have that the use of the substance has significantly affected their relationship. And that, they keep using the substance even though it affects them physically, psychologically, and socially, and, in terms of giving them debilitating results, and they're still using it. So being addicted doesn't mean that someone has a disorder. However, we look at that. Does it really matter whether or not I'm diagnosed with a disorder? Does it really matter? What matters is that, whether I'm well or not. So therefore, I would like to sort of pause here and again, remind us as a church community what the role of the church is. The role of the church is not to decide or determine whether the person has a disorder or not. We are to look at the welfare of the person. So let's not focus too much on what kind of disorder this person has, what kinds of addiction this person has, right? Let's focus more on how do we help this person to be well. I also want to sort of have a few minutes to note substance abuse symptoms. So individuals who, let's say, take substances, they could produce symptoms that mimic symptoms of psychological disorder, such as depression, manic behaviors, anxiety-related behaviors, psychosis, meaning, they have delusion, hallucination, and the rest that you see on this list. So what, again, I want to sort of caution us is that, don't worry too much about what this person is having. Sometimes we tend to sort of worry a bit more about, okay, I really need to know what this person is having first. Actually, as a church community, let's leave that to the health professionals to decide, because sometimes it's very, very difficult to differentiate someone who has a substance abuse problem versus someone who's depressed. Because symptoms, there are some symptoms that are very similar. So, let's not misinterpret what they have. Just know that this person needs someone to walk alongside with. If they need to go and seek medical health, medical support, or professional support, let's make that happen. So let's accompany them. Let's encourage them to find out more as to what they are experiencing. So that is the role of the church. Okay, so I'm done with my first segment in terms of perspective. I hope that, we can have a little bit better idea what addiction is and have a bit of a nuanced understanding of what addiction is. Right, the second segment is about this question that a lot of people ask. Why is addiction so hard to break? Right? Why is it so hard to break? And it's a question that is very, very important for us to address, because if we know a little bit more about this question, it can help us increase our empathy. And it can help us be a little bit more patient. It can help us to stay a bit longer in this journey, a very long journey of walking alongside someone who struggles with addiction. So understanding this is crucial. Do you remember this quote that I gave you earlier? That at the heart of addiction is this ache, is this pain. Of course, it's not true for everybody, but for many people, it is. And coping with pain, many people go to something to cope with pain rather than someone. We may sort of ask this question, we should ask this question as to why is it that many people go to something rather than someone to cope with the pain in their life. For example, we have been in a pandemic for some time now, right? It is something unprecedented, and we're all trying to cope in some ways. And yet there is data that shows us that during the pandemic, there is this increase, right? There is this increase in the visits to emergency departments. This is the US data, and it's showing us that all drug and opiate overdoses, there is this increase in the demand for services to handle issues such as drug and opiate overdoses. So many more cases of overdoses happen during this time of pandemic. We also see, newspaper articles or articles in general telling us that there is this increased sale, there is this, heightened sale of alcohol, for example. I don't think that it's only in the US, in the Western countries, but in Southeast Asia as well. Now, these are, well, of course, they're not saying that, that people are becoming alcoholic, but it shows us that these are coping mechanisms that people are using to cope with stresses, to cope with things that is happening and they don't really know what to do about. And we need to ask ourselves this question: why are people going to substances or something rather than one another, rather than someone, to sort of talk and, journey together and wrestle with the issues together? So this is a question that we need to ask. Now, in time, the object of addiction actually helps in coping. We must understand that any coping helps. Any coping method is effective. However, not every coping method is adaptive. The reason why people go to something is because that something actually works to reduce, at least in short term, the problem. Either it masks it or it blunts it. It does work to a certain extent, but short term. And so people go back to the substance or that something over and over and over again because it has some effect. But we don't just want an effect when we are coping with a problem. We want a solution, isn't it? Some of the coping mechanisms that people or that we use are actually introducing more problems and not solving the problem that we are trying to solve. And so therefore, it is important for us to understand that, right? That things that people go to actually help in some way, short term. And in time, if there are no other alternative, this something becomes a lifeline. This something becomes the person's companion, the person's comforter, the person's whole existence. Yes, and actually define who this person is. And if this person does not have an alternative, it does not have, a renewed opportunity, let's say, to develop who they are, an opportunity to work and put food on the table, the opportunity to provide for their family, put a roof over their heads. If there is no opportunity for an affirming relationship, meaningful relationship, cutting that lifeline or removing that lifeline from them doesn't quite make sense. Obviously, if we adamantly remove that lifeline, it's really, really painful. It's a huge loss, right? It doesn't make sense why someone would let go of that lifeline. And that's something that we need to understand here. And so I like this quote: all addicts feel that jolt of loss when they finally reluctantly turn their back on this friend, this lover, this part of themselves. It's agonizing. Now, I just want us to sort of think a little bit and maybe do a self-examination. What would jump up to you? Are we empathizing about the agony that I mentioned just now when someone tries to cut that lifeline? Or are we more focusing on that reluctant, that word reluctant? Why they're so reluctant? They should know that they should just, remove this. This is not a good behavior. So maybe I'll take a pause here and ask us to relook at our perspective. Empathy requires us to understand another person's perspective. Can we do that? We can't do it naturally. We have to practice doing that. So when the object of addiction is used over and over and over again, it eventually becomes the lifeline of that person in pain. And because it's a lifeline, it is difficult to break addiction. When we cut the lifeline without giving this person an alternative, then it doesn't make sense. And that's why they hang on to it for life. There are two more reasons as to why addiction is so hard to break. And I just want to go through them so that we have a better understanding to answering the question, why is it so hard to break addiction? So number one is a lifeline. The second reason is that in time, the object of addiction becomes, using the object of addiction become an established habit. And so the person is using the object of addiction not only because it serves a purpose, either reducing the pain, numbing the pain, managing the pain. The person also finds himself or herself embedded in this cycle of addiction. So let me explain the addiction cycle a little bit. So the cycle always begins with a need. There is a need. And this person starts using either a substance or engage in an activity for that relieving effect. Remember that it is more about wanting rather than liking, although it may start with liking. Okay, so if the person, for example, start using alcohol, now they find that by using alcohol, by taking alcohol, there is some relief shortly after consuming alcohol. And that relief from that need that they have is something positive, but only lasts for a short while. And then they go into this moment where they are back to reality and they have lost the sense of relief from the alcohol that they're using. And they start remembering during this loss of relief how nice it was, how relieving and comforting it was when they were using the substance. And then when they are relieving the positive aspect, right, of using the substance, they also, in their environment, there are many things that remind them and that create this craving for the substance. And in time, they start using the substance again. And time after time after time, in time, the habit is formed. The habit of using alcohol is formed. And in time, when this habit is formed, there are also changes that happens in the brain. Changes that happens when habit has been formed is different from the brain before the habit is formed. So our response, for example, to alcohol, when we first encounter alcohol, is different compared to when alcohol becomes an object or a substance that we use over and over and over again. So you may ask me, so what kind of changes happens in the brain? For the next few slides, right, we're going to go into the changes in the brain that happen during addiction. And there are two things that we need to know first. The first thing is that our brain changes with time and experience. Our brain is actually malleable. It changes, okay? It is malleable. So neuroscientists call this neuroplasticity. It's moldable, right? Our brain as an adult doesn't mean that, our brain just stay a status quo and doesn't change much, but our brain responds and changes according to what environment we are in and how we interact with our environment. And our response to the environment in turn changes the connection within our brain. And so this relationship between, our interaction with the environment and the brain changes is very, very important to know when we try to understand what happened to our brain during addiction. So this neuroplasticity is happening when the habit of consuming certain substance happens. So the brain is changing as the habit develops. The second thing that we need to know to understand the brain changes within the time of addiction is to know a few parts of the brain, yeah? How these parts of the brain are involved in our experiences of impulses and how we regulate impulses. We all have impulses of all sorts. Like I have an impulse of just, having a cup of coffee right now, or, having something that, will calm my nerves. I have the impulse, right? So we all have impulse all the time. And there are different parts of the brain that are significantly involved in our experiences of this impulse, in our regulation of the impulse. So let's start with this, few portions of the brain before we go on to look at how addiction changes the brain, yeah? So let's start with nucleus accumbens here. This is a structure, okay, found right deep within our brain. It's our motivational engine. It makes us pursue goals, okay? It makes us want goal. And what is it that we want? In general, we want to pursue goals that are pleasurable, right? Goals that are good for us. And also, not just that, but we also have the goal of moving away from pain, moving away from unpleasantness. And this nucleus accumbens is that motivational engine that create that desire and attraction to this goal and make us want the goal. But wanting the goal is not enough, for us to get the goal, right? Focusing on the goal is also important. And this part of focusing of the goal is determined by VTA, right? Don't worry about what VTA is. All right, somewhere in another part of the brain is what we call a dopamine factory, right? It produces dopamine, and this is a chemical that literally energizes nucleus accumbens. So both of them help us pursue a certain goal, focus on certain goal, right? Paying attention to a certain goal that we are pursuing. But of course, we have a lot of impulses. We have a lot of impulses in our lives, right? Every single day we have a lot of impulses. But not all impulses are things that we should have, right? We just have impulses, but we also have another part of our brain that evaluate, hey, wait a minute, is it good, these impulses for you? Is it the right time to have it? Do you need to have so much? Can you not have less of that? Right? So the prefrontal cortex help us evaluate these impulses and form certain judgment and develop the self-control that we have in managing impulses. So in short, in a nutshell, there are parts of our brain that helps us, like the accelerator of the car, okay, help us move towards the goal. And there are certain parts of the brain that exert that brake to help us not ram into something dangerous. And together they work with other parts of the brain. It's more complex than what I'm showing you, but they work with other parts of the brain to help us experience and manage impulses. Okay, so once we understand that, look, there's this mechanism to help us manage our impulses. What happened to this mechanism during addiction then? So let's look at this mechanism during addiction, the development of addiction. Now, during addiction, when there is a need, now nucleus accumbens get activated, right? And the relationship, or rather the pathway. So these two structures become strengthened. When there is a need, and this need reminds us that, hey, I want to get that object that make me feel better. I want to focus on that object that make me feel better. And that urge, right, that drive or that accelerator becomes much stronger during the development of addiction. However, the communication between prefrontal cortex and the nucleus accumbens start to weaken. So while we have an overexcited, goal-getting kind of mechanism, the mechanism that put some measure of control over that, that urge to get goal of all, at all costs, the control is not as strong. So in other words, during addiction, the development of addiction, the individual has stronger compulsion. The accelerator is activated much more strongly than the brakes. So this individual have weaker regulation of impulses. And there's plenty of studies suggesting that these changes in the brains happen to individuals with addiction. And the picture looks more, in a sense, it's more problematic. So the regulation, the brakes is weaker in individuals with longer duration of addiction. So these brain changes happens in all these addictions in a very similar way. So meaning that, when we become weaker in our capacity to regulate impulses in time. But these changes does not only occur with addictions on this list in front of you, it also happens in activities such as this. Do you know what I'm talking about? Do you know what kind of habit I'm talking about? I think all of us are very, very familiar with this, isn't it? And I think that we are all, to a certain extent, at some point of our life, we have done that. We've done that. The only difference between this activity and the list before, right, that I'm giving you here, the only difference in this list and this activity is that this activity is more socially acceptable. And of course, it may not have as dire consequence as some of the activities that I showed you in this list. Nonetheless, the brain mechanism that is involved in this list of behavior and this habit is very similar. This is a form of addiction as well. And yes, it does affect not just us, but people around us. It does affect relationship. It does affect concentration on other things. As I said, the only difference is that this is more socially sanctioned. The third reason is the now appeal. Okay, so we know that it becomes a lifeline, it's an established habit, and it's a now appeal. I want to explain the now appeal. Now, we want immediate reward versus delayed reward. We are always going for the now. And the future takes a back seat. And instant gratification is being encouraged, sometimes by stealth, with the new technology that we are all very used to. We want things now, we want things instant. And that, in a sense, is what makes, breaking addiction very, very difficult. Do you remember this structure, VTA? It focuses our attention on immediate goal. And in individuals with addiction, VTA focuses the attention on that object of addiction, far more than the attention on anything else. So much so that all other goals are obscured. Only the object of addiction is in focus. So there is studies looking at, natural things that should give us pleasure, for example, eating, sleeping, yeah, it is a pleasure activity. We gain a lot from just eating is enjoyable, sleeping, and having a good rest is enjoyable. But for individuals who has been addicted for some time to a substance or an activity, even natural behavior become less pleasurable. And things that used to be pleasurable in the past become less pleasurable as addiction continues. So all other goals are obscured. Only the object of addiction is in view. And so I hope that, with all this explanation, I know that, it's a lot. I hope that it helps us at least to have a little bit more understanding of how hard it is in the breaking of addiction, and why that some people would say that the hallmark of addiction is its relapsing nature. I think what I want to say tonight is that breaking addiction cycle is not an individual's work per se. It's not just the work of the individual with addiction. It's a concerted effort that involves both you and I. It is hard enough breaking addiction. It's like climbing Mount Everest. It is very tough. Can you imagine doing this alone? They need somebody to journey with them. They need somebody to hold hope for them. They need somebody to believe in them even when they have given up on themselves. And that is something that we can do as a church community. We need to break addiction cycle alongside this person as a concerted effort. I think that, I've said quite a bit this evening, and, I think that it is quite clear that if we are given the same circumstance, the same kind of body makeup, the same kind of genetic predisposition, we may end up also choosing to use substance or engaging in certain activity that help us reduce that pain in not such an adaptive way. So what I'm saying that all of us are in the same boat. As a spiritual status, we all need redemption. We all need transformation in our lives. And as an embodied spirit and mind, we are embodied with a broken body and a broken mind. We are fallen. So in actual fact, we are all in the same, in the same situation. We all need the Lord Jesus. We all need God. So we also know that because addiction is very difficult to break, the situation in professional centers of, drug rehabilitation center, for example, right? There are people who have successfully being treated, of course, but there are also many who continues in this journey. It is not easy. But what can we do as a community? See, so what is lacking? What can we provide as a community to these individuals who are in this journey of trying to manage addiction? Let me share with you again. I hope that you would want to sort of try and get this book by Mark Lewis. Yeah, I think that it's really important also for the Christian community to understand the perspective of, let's say, someone who's not a Christian. And he's a neuroscientist himself, who has his own journey of addiction, and he wrote this book. And in his book, I found that he has the same kind of desire as a person, and that he has such understanding of the struggle of someone who is in addiction, that I think that it is useful for all of us to read his book and have a better understanding from his perspective. So Mark Lewis said this: the addict's life is lived in a tomb of the present, dead, because the present is dead for an addict, because he has lost his connection with the story from which it come, or from which we came, the past. The past is not something that they are proud of, for example. And he said humans need to be able to see their own lives progressing, moving from a meaningful past to a viable future. They need to see themselves as going somewhere, as characters in a narrative, as making sense. So if you just look at these two passages, right, these paragraphs that he wrote, what is it, do you think, that is lacking in the addict's life? What do you think that they need? I think when I look at these, I think that they need the same thing, or they crave the same thing as any one of us. They need meaning. What is my purpose? They need community. How do I fit in? And they need an identity. Who am I? If my present is dead and my past is not very, but I'm not very proud about my past, is there a future for me? How do I see myself? Can they find these within the church? And that's the question that I would like to pose today in this community. Can these needs be found in church? Are we providing a community that they could get these things from? When I look at Jesus and his encounter with a variety of people, especially individuals with deep sense of shame, and there are many of them throughout the Bible, right? But during the time when Jesus walks the earth, his encounter with a variety of people tells me that he engages each individual, especially again, those who are deeply in shame, he engaged them as a person. He talked to them as a person. And he provided them future, identity, restoration, and relationship. If he has done that, shouldn't we follow as the church? I'd like to share some feedback from some NGOs as their response to Christians visiting the rehab NGOs. So allow me to share with you some of these. So it says, one of the responses, treat them like humans. And so I was wondering, what do you mean by that, right? Is it because the Christian community don't treat them like human? You know, what does this mean? It's actually quite telling when you look at some of these responses. Don't just come to preach to them. Connect with them. Ah, right, okay, treat them like human. Don't treat them like something that you fix. Don't ask questions that make them relive their failures and make them feel that that's all they are. Oh, you're an addict, so how do you get addicted? What is it that you get addicted to? How long was your addiction for? Blah, blah, blah. It's all about addiction. So I think that shows, yeah, the way, the perspective that we have when we connect with individuals who struggle with addiction. Empower them with new skills. Give them an opportunity to contribute. Don't just come and, try to fix them, but give them an opportunity to contribute. So all these responses, get me thinking a little bit about the posture of the church and what is lacking from the community, the Christian community that is called to provide soul care. I think that, the church must remember a few things. Number one, addiction begins with a need. That, we need to talk about the pain that is the reason for the addiction in the first place. We need to get them there. We need to talk about that rather than, just about the substance that they're addicted to. People with addiction wants to quit. The church must remember that it is, something that they want, right? They want to work hard to quit. And therefore we must support them emotionally, financially, as best as we can. And we must believe in the fact that, they can do this. People with addiction are made in the image of God and therefore highly valuable, inherently valuable. And hence, we must connect with them as person, not just a person with addiction. People with addiction need to see a future. So let us hold that hope for them. let's sort of see if we have that, can we as a community, we are placing all different part of the world, or, different capacity, different function, can we provide opportunity for new life in different aspects? Can we provide that? Can we think about that? And lastly, most importantly, I think that addiction is only part of the person's story. It's not the person. Addiction does not encompass the person. They are much more than that. And if we can do this, if we can remember this, then I think that we can provide an alternative to that lifeline that they're hanging on to. So I want to end with this slide, because I find that this slide is very powerful. This quotation from a researcher in addiction. It says, substance misuse is a choice. Crime is a choice. Going back into addiction or crime because no one gives you a job, a chance. They are unwise, antisocial, selfish choices. They are also choices made in response to very challenging feelings and circumstances. Discrimination is also a choice. Stigma is a choice. They are choices made due to fear, assumption, misinformation, prejudice, and discomfort. They are also unwise, antisocial, selfish choices. These choices, while partially understandable, are ineffective in ending the reality that everyone is facing. Addiction is here. It is a problem that both causes and is caused by so many other issues. Making a new choice to help rather than stigmatize addicts would start to break the cycle of suffering and addiction and help the whole society to recover from its impact. Don't you think the church is seen in this passage? Battling addiction is a concerted effort. It is not an individual effort. Jesus said, "Rejoice with me, for I have found my sheep that was lost." The thief comes only to steal and kill and destroy. I came that they may have life and have it abundantly. May the Lord help us to be a church that He has called us to be. Thank you. So I return the time now to Hai Yan.
So the question is, addiction is coping with pain rather than seeking pleasure. Can pornography addiction be an exception to this? Actually, there's another question quite similar. She's just asking on gambling, like gambling is not coping with pain in a way. So how do you explain that?
That's a good question. Thank you so much. I think I must qualify that I said that, it's not for everybody, but many at the heart of their addiction is a need. There is a need, it's a coping mechanism. And as I said, you can cope for a variety of reasons, right? And the need for a variety of reasons. But, many of these needs is associated with some kind of pain. So like, pain of rejection, the pain of, not fitting in, the pain of not belonging, the pain of, not having confidence, and so on and so forth. So I think that there's a broad area of description that could actually fall into that, the umbrella of need. Yeah, and so if you look at it that way, then I think that, of course, any addiction can start with it's for pleasure, right? As I said, I think that, we are creatures that go towards pleasure. That means, we rather that we are creatures that avoid unpleasant things. We go towards something that's pleasant. And so, in terms of pornography, not everyone, started using pornography as something pleasurable. There are other reasons. perhaps, right? Or some actually it's an experimentation. And so, it's not necessarily always seeking pleasure, but it can start like that. And then, it can contribute very quickly to the addiction cycle that I mentioned earlier. So I don't know whether that actually answered the question. But yes, certainly. I don't think it's an exception because, there are other form of addiction that people started out seeking for, something positive. You can describe that as pleasure too. Yeah, but as they progress and as addiction becomes embedded in the cycle of addiction, then even when the person wants to stop it, and it's because, they are not quote unquote enjoying it as pleasure anymore. They know that it's creating a lot of problems and they want to stop, but they couldn't stop so readily because it is an issue of wanting rather than liking. And after a while, people who, who use certain substance that they used to enjoy, it becomes unenjoyable anymore, but they still need to use it, you see?
Oh, yeah.
Yeah.
Yeah. So you started with pleasure, but if you can't.
You can start with pleasure. Not everything starts because of pleasure, but you can. You can start, anything. The addiction journey can start with pleasure. Yes, of course.
Yes, okay. Thank you for that. And the next question is, what are some of the soul care the church can provide in helping one to overcome addiction?
I think, to be honest, tonight we have begun, we have begun the steps of providing soul care. I don't see soul care as only providing comfort, providing solutions, providing practical help. I see, very much that part of soul care is understanding a certain scenario, understanding a certain phenomenon like addiction, understanding mental health, for example. Right? What are some of the struggles? What are some of the things that maybe we are not so aware of? Understanding our own limitations, understanding our own tendency to, let's say, see things from our perspective and not taking, our understanding from the other person. Like understanding addiction from our perspective can be quite damaging. Because it's like, if I can do it, why can't you? If I can quit my coffee, you can quit your heroin. I mean, it's a very common statement. But again, that shows that there is a lack in taking perspective, i.e. there's a lack in empathy. So I think we have already started, and that's why I want to congratulate STM for starting the journey of wanting to, wanting to put us together, right, as the big C, to start at least talking about it, have a conversation. I mean, the conversation on addiction has started so long ago, and it's time for, it's high time for church community to start talking about it at various levels. But of course, the other thing I thought that would be really, really nice for the big C to start thinking and be actively involved in is, to intentionally not see the person as just the problem. You see, we are talking about addiction this evening, but it could apply to anything else. Like, if we're talking about, mental ill health, we're talking about people who are, let's say, having relationship issues, or people who are having sexual issues, we tend to see the problem. Yeah, we tend to equate the person with the problem. So whenever we try and minister, quote unquote, minister to these individuals, we have this, maybe we're not aware of it, but we have this tendency to want to fix the problem. Of course, fixing the problem is part and parcel of walking alongside an individual, with a variety, right, of issues. I mean, of course, it'd be fantastic, if we could help in very practical way to, get the person in a better position, of course. of course. But I think that our posture as somebody who walk alongside people, we need to see people as people. We need to see people as persons. That means, you know, who they are become a lot more important to us than what they did or what they did not do. So that our conversation, our posture, our caring become the whole, you know, the soul. The soul is the whole holistic care, not just the biological side, not just the mental side, not just the spiritual side. It's everything. And we can only do this when we treat the person like how Jesus treat them. Like Jesus never said, you know, to Simon Peter, hey, you betrayer, you know, or to Thomas, hey, you the doubter, you know, or Zacchaeus, you the tax collector, you know, although the Bible actually describes tax collector, but you know, he doesn't define individuals that way. He calls them by name, he talks to them, you know, and he gets to know them, he allows them to get to know him as a person.
Yeah, I guess we really need time. I would say how we care for people is actually time. Spend time with them rather than programs. I would say something like that.
Yes, and that, you know, they are not, it's like, you know, we have our posture, our position in helping has always got to be on equal standing. You know, we can't be sitting up on a horse somewhere telling them, hey, this is what you need. This is, I'm here to help you. You know, it's got to be on this level that, hey, you know, can we talk? You know, can we journey together? You know, I also have issues. Yeah, I mean, so we are seriously, we're human. Okay, so we can journey together. You know, how can we talk about it? You know, what can I, you know, what can I can also share with you certain things, right? So we are on equal ground.
Like Jesus is with us, came to us. Okay,
absolutely.
We have a lot more questions coming up. Okay, so yeah, we shall continue with our questions. Thank you for uploading. Okay, this one is from Yun Po Chin. She says that, what is the real difference between hobby and addiction, and how do we draw a line? So, and when is the hobby become addiction?
Okay, I think that the word I'm thinking about is dependency, and you know, the ability to habit is something that hobby is something that we like doing. So again, you know, if we were to look at what we just talked about earlier this evening, it's not just one thing, it's actually liking. I like what I do. You know, if I play the guitar every day, it's because I really enjoy, you know, playing guitar. I take pleasure in it. It really, you know, you know, it gives me some relaxation and so on and so forth, you know. But addiction can involve, you know, dependency. Even if I don't want to do it, I have to do it. I think so. The word still is, you know, the demarcation, you know, could be that level of dependency. So I differentiated, you know, using the word want and like. Hobby is something I like, pleasure. You know, I like, right? I like to do it, and therefore I do it. And addiction is that I may not like it, but I have and I want to do it.
Okay. Another question here is, if a person who is a non-believer with addiction, say alcohol in this case, does not acknowledge that he has a problem, what would be a good approach to handle such a case? Non-believer.
Yeah, correct. You know, I mean, get to know this person. Yeah, and that's why I said that, you know, one of the better approach, you know, whether you're you're engaging a believer or not, you know, treat them like a person, right? The alcoholic, the alcoholism, or you know, the addiction with alcohol is not the only thing in this person's life, and it could be the present thing. It could be the present thing that create a lot of problem, and just like what Mark Lewis, you know, in one of his quotes saying is that the present is dead, right? Yeah, and you know, you don't really want to focus solely on what is dead, but this person has a history and definitely has a present and has a future. So, you know, I think getting to know the person, being the person's friend, requires us to actually get to know the story, his story, right? His story. So his story includes alcohol, but there are also other parts of the story that does not include alcohol. Get to know that part, care for him as a person, talk to him, about anything under the sun other than alcohol. Of course you can talk about that, if he start talking about it, but there's so many other things to engage this person with. And again, don't engage the person as if that, you're trying to just fix the person, either fixing the alcohol problem itself or, preaching the gospel to the person, just like what the NGO was, sharing with me. I think in that context, that NGO person was telling me that, sometimes Christians groups come and visit. And what she found really, really upsetting is that the conversation just goes directly into evangelism, and not caring about whether that person is having a good day or not, whether that person is having a major struggle with his symptoms. It's just like zoom in. Sometimes I think in our enthusiasm in evangelizing, I think in our enthusiasm of sharing Christ, we actually miss the person. We're so focused on sharing Christ that we miss the person in front of us. So we're so focused on our tasks, and I think that we really, really need to go back and look at Jesus. I think that Jesus is our model in terms of how we engage with people. Jesus don't zoom in and talk about the kingdom of God immediately. You look at, a lot of example, women at the well, Zacchaeus, and all, he doesn't zoom in. Like, repent, you're sinful. You got so many husbands. You are a tax collector. You are adulterer. He does not do that. Although we also know that he is, he's not somebody who tells us you can do anything you want.
Yeah, he cared for the sinner.
Yeah, I think that's his posture. Yeah. Isn't it? He talked to the person as a whole person. It's not just the person talking about the sin, not the person. You see, he doesn't demarcate, he doesn't separate these two.
Yeah, like these questions also ask is like, if we have put a lot of effort in it, but they still refuse to be helped. Yeah,
I think this is a very, very good question, because, it's a very common experience that, as a church trying to walk alongside people of coming from a variety of contexts and, struggling with various issues, we must remember that while we journey with them, we cannot journey for them. Right. And I think that we must have this understanding too, that, we remind ourselves. I mean, I also get carried away, sometimes I have this savior complex, I go about, and try, okay, I need to save this person. I need to, I need to get him to eat the medication and I mean, as psychology, you get into this kind of mode, right? And then I sort of whack myself and say, come on, Hera, remember that this is, So I think that we need to constantly remind ourselves our role. Our role is not to make decisions for the person. We can't live their life for them. So if you have done everything you could to help the person, you must do one more thing, and that is to allow the person to make the decision. And I know that, this is really, really hard, because especially if this person is somebody that we really care for and really is significant to us, it's very agonizing for us to hear a decision that is like, oh my goodness, this is not the decision that you should make, and then we get so flustered about it. I can understand that, but at the end of the day, we are not the one who fixes. God is. So we are asked to love another. And I think when we love another, we have to ask ourselves, to what extent? For how long? Right? So that's the wrestling that we have with our role. And looking at Christ again as, as an example, as a model, I don't think Christ makes decisions for people. I'm sure that, there are instances that people reject him. Many instances. And while that is very, very painful, that is something that the person has to make as a decision. We all have our own decisions to make. So let's do our role well, and then, let the person do what he or she must do, and that is to make decisions for himself and herself, while praying that the Holy Spirit would reveal, right, what is the right thing, what is the needful thing, and also to help this person come to terms. Because a lot of time, it's not easy admitting you have a problem. Turn it around. Would it be easy for us? So I think, again, perspective taking is necessary, but it's hard at times, especially hard when you're helping someone you really care for. So well done in having, done so much for the person. I think that you can continue, and you must continue praying that God would hold this person in his hands, and, that you will continue to journey with this person. Nevertheless, let him or her know that, that this person means the world to you, and that you're going to hold hope for this person, even if he or she has given up. That's what I said earlier. And it's one of the hardest, because a lot of people want to give up on themselves. So without people believing in them, despite them giving up on themselves, then life could be really, really tough.
So following your response just now, this is another question which I think is like, how do we draw the line between supporting the person and actually being taken advantage of?
Yeah, I think that this is a question on setting boundaries and knowing your limitations. Okay, and don't worry if you have to keep changing your boundaries. Boundaries do change, and nothing wrong with that. Sometimes you realize your limitations only after certain distance in the journey, and it's nothing wrong to redraw that boundary and to communicate the boundary. I think the important thing is that, if you want to continue supporting the person, is not to lose the connection. And if you don't draw the boundary or redraw it, you definitely will lose this connection, because you will get fed up, you will give up, and you will resent this person. The likelihood is very high.
I mean, when you draw the boundary, how do you get out of it? Because especially people that you really love and you're being taken advantage.
Of course, it's hurtful, of course it's hurtful. And there are many, many situations where we have to, again, recalibrate and ask, ourselves, is this the role that, that I am called to, and if it is affecting me so much, like it sort of causes me a lot of sleepless nights, and it makes my relationship with other people, everything is affected negatively. That's not a very healthy relationship to be in. And so therefore, we have to understand our role. And again, our role may change. We may think that, we are supposed to walk alongside, and we are okay to walk alongside. But then sometimes we realize that we're not the best person to do so. And again, forcing ourselves to be the savior and having savior complex is is not helpful either to the person you're trying to walk with or yourself. And then we can end up having both, two people being, severely affected, not just one. And so therefore, it is so important to revisit right? To revisit the connection, the relationship that you have with the person you're walking with. There are certain things that you're not best person to help with. And, you know, you can either involve another person while continuing to journey. Whatever that you do, in this case, in this context, it seems that you have to recalibrate your role, your boundary, and then communicate that it's not an all or none, meaning that you don't have to like drop the relationship in many instances, but of course, in some, it has ended up to the extent that is not salvageable, then that has to happen. But in many cases, it's a matter of redrawing. It's a matter of communicating sometimes, right? Maybe because you are clear about the boundary, but maybe the person is not clear. And so you can reiterate the boundary and make sure that it's clearly communicated, right? The important thing is as you walk alongside someone, you've got to be well. You have to have self-care. Otherwise, you're not going to help. Not going to help yourself and not going to help the other person as well.
Thank you. The next question is, how do you journey with someone who's struggling with an addiction that affects you, knowing that this person will fall from time to time? And as in, how do you not take it personally and continue to keeping on with this person who is very dear to you?
Yeah, maybe I'll just add one more thing is that, you know, in self-care, no matter who you're working with, it could be your spouse, it could be your family members, especially when they are somebody that, you know, this person is somebody that is your family. And you become a carer, not because of choice, right? Because for many of us, you know, we are walking alongside someone in the community who is not our family. We choose to walk with this person. But for many of us, we don't choose, right? We don't get to choose. And, you know, and sometimes the things that are done or words that are spoken, especially when we are in a journey of addiction, is very, very painful. And so I do think that it's important for everyone in this kind of situation to make sure that you have good self-care, that you need to protect yourself and you need to care for yourself, and nothing is wrong doing that. And one way, of course, you know, that if this is something that is workable, you must also put on an armor every time you journey with this person, because a lot of things that they say and do might be hurting you if you don't wear an armor. What do I mean by wearing an armor is that you, if possible, you don't take that personally. That whatever things that has been said and done is part and parcel of the symptom of addiction. However, it'd be ideal if you have somebody else walking with you to support you. So that's you know, one of the main things that I would like to sort of add.
Okay. Last few questions. This one is asking, is depression a form of addiction?
Strictly speaking, no.
All right. Okay.
A nutshell, no.
Okay. Then the next one we have here is I think this will be our last questions.
Yeah, I think that, you know, that's why it's difficult. I think a lot of this question, I'm sorry, I just could just, you know, answer on a surface, although I'm not sure that I've done justice to your question. Like, for example, the depression one, I think you may be asking if it's, you know, depression and addiction comes together sometimes, like, you know, individuals who struggle with addiction, could they have symptoms of depression, or could they become depressed? Or could they experience depression at the same time? The answer is yes, it's possible. Depression, in fact, addiction is, you know, people with, you know, just now the slide that I have in the beginning when I said there's a multiple factors that contribute to addiction. One of them is mental illness, right? So individuals with mental illness are susceptible. Okay, I'm not saying that they will definitely, you know, be at risk for addiction. They are susceptible to addictive behaviors, right? Because there's a lot of things that that the person need to cope with when you're living with a mental illness, especially certain mental illnesses. So can depression be part of the experience of someone with addiction, or vice versa? The answer is yes. In doubt, right? If you are having that and if you are doubting whether or not, you're beginning to either sense that, you have problems with addiction, or that, you have symptoms of depression, go talk to somebody, okay? Don't do this alone. And there's plenty of help out there. Talk to somebody you can trust to go with you, right? To seek, professional help. Nothing wrong to see a psychiatrist, because they're the best people who could assess what is going on with you. And, seriously, if nothing, if your concern is not true, then you just come home with the psychiatrist telling you, oh, no, you don't have depression, or yeah. So just go find out. It's nothing wrong with that. It's just that you may need somebody to accompany you because it can be quite daunting, isn't it? Seeking help. So that's what I would say.
Okay, it's already 9:46 actually. Sorry, because of time constraints, so we have to end the webinar. Thank you for coming. Before we leave the webinar, we really need your feedback. And with that, we just want to thank you for coming. Thank you. Good night.